What do we know about inflammatory bowel disease? What do we want to know?
Inflammatory bowel disease, or IBD, is a family of diseases that cause inflammation in the lining of the digestive tract. IBD can cause symptoms like abdominal pain, fatigue, diarrhea, bloody stool, loss of appetite, and, unique to children, can cause impaired height growth and delayed puberty.
Symptoms can stay quiet for periods of time, then flare up, which disrupts the body's ability to digest food, absorb nutrients, and even poop in a healthy way. People with IBD often have trouble doing things they normally do when they're in a flare, and have to visit their GI specialist, called a gastroenterologist, regularly to help manage their symptoms.
Canada has one of the highest incidences of IBD in the world, with rates increasing in children. It is important to ask what Canadian patients, their families, and the clinicians that care for them would like to see prioritized in IBD research.
A team of pediatric GI researchers in Canada has come together to form the Canadian Children's IBD Network, a partnership of the Child Foundation and the CIHR.
Investigators set out to engage patients and families to help determine what questions Canadian IBD researchers should tackle. They used a priority-setting partnership model designed by the James Lind Alliance. Here's how it worked.
National Survey Number 1. A special committee of patients, parents, and clinicians and researchers was formed to develop a Canada-wide questionnaire, asking patients to submit any unanswered questions they had about topics relating to IBD. A total of 1,209 questions was submitted by 366 participants, including patients, caregivers, and clinicians.
Analysis. The list of questions was condensed, eliminating duplicates and questions that already had answers.
Clinical practice guidelines. Researchers have questions too. A member of the research team reviewed the literature to find common questions that researchers are currently trying to answer about how IBD affects patients, how it is treated, and how we can improve treatment options.
National Survey Number 2. A second national survey was sent out asking this group to rank out their top 20 questions according to what they felt were most important.
Prioritization workshop. The committee invited more patients, family members, and clinicians to join them at a full-day meeting in Toronto to review the top 27 questions and deliberate which ones would make the top 10.
Here's what they came up with.
10. What is the optimal approach to diagnosis, education, psychological support, diagnostic tests in pediatric patients with IBD?
9. What is the impact of access to psychological and mental health support in the management of pediatric IBD?
8. How does an early diagnosis of IBD in children and/or teenagers impact the lifelong course, prognosis of the disease?
7. What are the long-term effects of medications used to treat IBD?
6. How can we increase the knowledge and/or awareness around pediatric IBD so that diagnosis is not delayed?
5. How can we better define the role of and improve access to newer non-invasive, less costly biomarkers of IBD endoscopic activity?
4. What triggers flare-ups in IBD?
3. What role does diet have in the management of IBD?
2. Can IBD be prevented?
1. What are the causes of IBD? So what's next?
Researchers have a job to do, to help find answers to these questions. In order to do this, we need the IBD research community and research funders to support this work.
How can you help?
Look for opportunities to take part in research, whether you're a patient or family member.
Support those in your community with IBD by advocating for washroom access, and understand that just because an illness might seem invisible, it does not mean it is not affecting people around you.